Hi guys, Harpreet here. As promised, I am back with some more information videos in relationship to our REXPN, NCLEX RN, and NCLEX PN series. So today we're going to talk about Bloom's taxonomy and how and why is it super important to understand and to read. I'm not saying that you should be studying this, but you should at least know what kind of questions are they asking you, what kind of items the NCSBN prepares for the candidates, for the students to answer. So let's talk about it. So this little triangle is a very good descriptor of Bloom's taxonomy. Those of you who are in education field already, they must be very familiar with this because a lot of our teaching materials from the very basic levels of teaching elementary school up to the university levels, we always use Bloom's taxonomy to create the objectives, learning outcomes, and even to create the items to evaluate our students. So as you can see that this is an inverted triangle, which starts with the very basics of Bloom's taxonomy, which is all about remembering. So you learned something and now it's time for you to memorize it, to remember the concept. So if we are talking with respect to the nursing exams, this remembering would most likely be about recalling information. For example, you have to recall the signs and symptoms of a disease condition or the risk factors for a disease condition, or if you're studying your pharmacology, those could be the side effects of any medication or even the list of medications. So recognizing, listing, and describing, all these things come under remembering. And as you can see, remembering is a very, very lower level of doing any subject or any course. Therefore, you will barely find items for which will coincide with this concept. So NCLEX and REXPN exams, they do not work on nurses just memorizing things, because anyone can memorize. My 7-year-old, I can make him memorize all the lab values. I can make him memorize like potassium. Okay, it's 3.5 to 5.0 or 5.5, depending on which book you refer. But how will it make, what kind of difference will it make if you are a nurse and you know potassium, whereas this little kid also knows the normal value of potassium? Your job is you enter the patient's room, and just by looking at the signs and symptoms, are you able to figure out, are they going into hyperkalemia, hypokalemia, or if I'm giving them certain kinds of drugs, what is going to happen to the potassium levels of the patients? How do you relate digoxin and potassium? How do you relate the diuretics with potassium levels? So all these things, they are higher functions, higher levels of understanding. Therefore, as I said before, remembering is very basic. So you will barely find questions where remembering, just recalling of information is required. Then as we move forward, we move ahead to the upper levels. The second one is understanding. So now understanding is a bit higher, because here you are expected to explain ideas, concepts. You have to interpret them, you have to summarize them or explain them. Now, the questions, when you have questions about the dialogues of patients, right? For example, it's written here, understanding and making sense out of info. So the dialogues of patients, they are the questions or the items based on understanding. Which of the following needs further teaching, or which of the following indicate that your patient has correct understanding of certain disease condition, health teaching, medication outcomes. So those are the understanding concepts, and definitely there are questions, but again, not as many as the other higher levels. Then the third one in this same triangle is applying. So this one is that you are now going to implement carry out, use, or execute the knowledge which you have learned. So by identifying the patient's signs and symptoms, by identifying their history, by making certain assessments, now you have to apply that part of knowledge into answering your questions in order to take care of them. So technically, you're prioritizing here. You're doing what is the best action out of the following, which you should be doing as an application of your knowledge, right? So that's where applying comes into the picture. Now, out of these three, I would say applying and understanding, they are both very commonly seen. However, majority of your questions you're going to see from analyzing. Analyzing and applying, they're very close to each other, but analyzing is where majority of your items are based on. So now analyzing is that you are breaking information into parts to explore understandings and relationships. So everything is, it could be categorizing their lab values. It could be their signs and symptoms. It could be knowledge of what medication are they taking. So when you have bits and pieces of different types of information, how are you basically using that information to answer your questions? How do you identify that which action is the most appropriate or which action should be done the very first? That is what makes it different from applying. In applying, you just use a certain amount of knowledge and you apply it. Whereas in analyzing, you're not only applying it, but first of all, you're making sure you're digging deep. You're asking all the why questions. Why is this the priority? Why is this super important to identify if this is the way my patient can be safe? Is this the only way if I can save my patient? So that's where analyzing can fit. Then the next one is evaluating. So evaluating is justifying a decision and checking if the course of action or whatever you did that help? Or it could be, making those critical judgments, criticizing something, or at the same thing, that there is a course of action which you're taking, and you have to now evaluate, why are you taking this course of action? Why is this appropriate for your patient, right? So again, like knowing my patient's symptoms and then evaluating on the basis of those symptoms that, okay, what could be the appropriate action, right? And again, just like analyzing, evaluating is a very higher or high difficulty level of questions. So you're definitely going to see questions from this one. And then the last one is creating. Creating is about generating new ideas. It's about doing some constructive work, producing something, planning something, inventing something. A lot of questions from creating could be based on health teaching or creating a plan of care for your patient, even though it's considered to be a very higher level, but still teaching patients is not, it does not carry a huge amount of weightage on your NCLEX and Rex-PN exams. So now, as you can see from this little diagram, analyzing and evaluating. So these are the two areas you have to really work on. And how are you going to work on these two areas? By building very strong core concepts. So you have to go through the content. This is where having knowledge of content is very important. You should know all your systems. You should know the whys as to, like, why does this happen? Why is this DKA patient going into acidosis? Why are they going into ketosis? So you have to know the whys. If you know the whys, you will be very much able to answer your questions based on analyzing and evaluating, right? So we're not going to study superficially when we are studying for NCLEX and NCLEX RN, NCLEX PN, and even REX-PN exams. Dig deep. That's what is necessary, right? Now, if I'm saying dig deep, I don't expect you to start from the very first chapter, which is all about anatomy and physiology, because trust me, you might not like that, and then you end up not studying. You might open your textbooks, stay there for hours and hours and not getting enough. So instead of that, start from topics which you really enjoy studying, or go for certain reviews where you know that somebody is going to give you examples and influence you with their teaching. That's the best way of having this understanding of answering questions where analyzing and evaluating is based on. So I'm not done here. I have to give you some examples. So I will take each of these, and I chose this content from a book, which I will reference at the end. And here we have been talking about synthroid or levothyroxine, which is used for thyroid dysfunction. Okay, so we have questions based on this whole Bloom's taxonomy, and then you'll be able to understand like how they write items and what kind of questions should I answer, or what kind of content should I study, right? So let's do that. Okay, so the first one, we start with the basic, which is remembering. So as I told you before, it's the most basic one where your knowledge is needed. You don't need knowledge application, but your knowledge. So as you can see the question states that the nurse is administering levothyroxine, which is also known as synthroid, to a patient who is having hypothyroidism. So your patient has hypothyroidism, and the nurse recognizes that medication is prescribed to ABCD. So now you have to figure out that which out of the following is the correct action of this medication, right? So for that, if you really haven't studied levothyroxine, which word on this question statement, the stem of the question, which word would help you the most? So think about that word and definitely let me know if we thought of the same word. So I thought that hypothyroidism is a good word I can use because this patient is hypo. So my answer has to be based on that. So now let me know, or if you're watching and pausing, you can definitely comment down which do you think is the right answer. So the first option is replace the thyroid hormones. B, stimulate the thyroid gland. C, block the stimulation of the thyroid gland. And D, decrease the chances of thyrotoxicosis. So according to this, which one should be the best thing which could happen to a patient with hypothyroidism? Think from that point of view and think about the answer. And I'm going to tell you the answer is A, replace the thyroid hormone. So this is what levothyroxine does in a patient with hypothyroidism. It does not stimulate. Definitely, why would it block the stimulation? Because this patient's already hypo, and levothyroxine cannot decrease the chances of thyrotoxicosis, right? Because it's only going to level up the hormone. Okay, so this is a remembering question where your knowledge was essential. Now we're going to move ahead to a little upper level, which is understanding. So again, using the same drug. And if you remember what was understanding, it was explaining and interpreting and summarizing the concepts and ideas. So you're going to do some interpretation of information. So as you can see, the question has dialogues. Okay, so you have to see that this patient's going home with discharge and we're giving discharge instructions. So the question is, which of the following statements, if made by the patient, would indicate correct understanding of the medicine? So if we have to figure out a correct understanding, it means we're looking for the correct dialogue, the right dialogue. All right, so let's see which right dialogue it is. The first option is, I will discontinue the medication when my symptoms improve. Thinking from a routine medication regime, just think about it in your head, whether this is correct or this is wrong. Should people discontinue when they feel better? Then option number B is, I will take the medicine each day before breakfast and at bedtime. So is levothyroxine, like how often is it taken? So I need to have that information in order to answer this question. And then the last one is, I will feel more energetic after taking the medication for a few weeks. And then the last one is, I will probably gain some weight while taking this medicine. So now I have to understand what happens to people and which of the following do you think should be the right answer? So think about your right answer and you can comment down. And the right answer is, we don't discontinue the medication. Levothyroxine is given only once a day. It's taken once a day. And people don't gain weight with levothyroxine. So the right answer is, with the elimination technique, yes, this is what is a therapeutic outcome, that I will feel more energetic after taking the medications for a few weeks. So you'll have these kind of dialogue questions. So you'll have to understand that here too, having that content information. See, if I did not study the content, that what levothyroxine would do, probably I will not be able to answer this question, okay? Because for some things, common sense might not work. Then the next one is applying. So this one's your knowledge application. A patient with levothyroxine tells the nurse that he feels well and some days cannot remember whether he took his medication. Okay, so now here, this is really crucial, that this person cannot remember to take his medication. So what should the nurse do? And the nurse should following. So nurse should do something by which this person remembers to take the medication, because we cannot miss the doses, right? Tell the patient to come off the medication. So is it good? Then okay, don't take it. You can self-regulate it. Tell the patient to take his medication every day. All right, seems right, like right. Hey, you know what? You should take it every day. But does this help in making a kind of a substantial plan that this is the best way you can take your medication? This is the best way you can remember. He is telling us that he wants to take medication, but some days he cannot. So you have to decide whether B could fit there or not. Then tell the patient this is not an appropriate way to take any medication. Now, giving this little negative feedback, will this help? Will this be of any help, or will this shut off all routes of therapeutic communication? And then the last is, help the patient to develop a system to remember to take the medication. So this one is assisting, maybe using a calendar system or a pill box system. I'm able to assist you. Okay, every day, this is the best way you can remember. So do you think if this is the most therapeutic way? So out of A, B, C, D, which is the best answer? Which is the right answer for this guy who cannot remember to take his medication? I hope you've your answer already. So here is the right answer. Absolutely. I'm sure you must have chosen to help the patient to develop a system to remember to take the medication, because this is the most therapeutic way to help the patient. The other ways were not helping him. They were not answering his question. All right. With this, we move on to analyzing, which is now going to be a little more critical thinking will be involved. A more higher difficulty level will be used in these questions. So for analyzing, we are breaking the info into parts, and then we are trying to understand the relationships between everything. So we have, as you can see in the question already, we have a lot of information. So the nurse is assessing a patient who's been taking Synthroid for 5 weeks, okay? And during assessment, the patient's heart rate is 90 beats per minute. The patient has weight loss of 4 pounds. T3 and T4 have increased. So which action by the nurse would be appropriate? So the first thing you need to understand is, are these assessment findings normal or abnormal? So just answer this question inside your brain, and then you have your answer already. Number 1, are you going to hold the medication? So now you have to know what are the reasons when I would be holding the medications. Is the heart rate too much? Is this weight loss too abrupt? Are the T3, T4 not expected to rise? If yes, then I would withhold the medication. Then request to repeat T3 and T4. Now, we already know it. You have to tell yourself, if you have to choose this answer, why am I going to request for this one? The next is blood pressure. You should assess your patient's blood pressure. Are these assessment findings not enough that I would be assessing the blood pressure, or is there any direct link between blood pressure and my thyroid function? And then the last is administer the medication. So administer the medication will definitely be chosen if all these findings were normal, were expected therapeutic findings. So think from that point of view and choose an answer, everyone. So is your heart rate 90, like having a heart rate of 90, is it normal or abnormal? Having a weight loss of 4 pounds in 5 weeks, is it okay? And having higher amounts of T3, T4, was this the expected outcome? Did we want this? If yes, then administer. If no, then choose anything from ABC. All right, so I'm sure you guys have your answer, and the correct answer is D, administer the medications, because weight loss, increasing T3, T4, pretty much expected, and heart rate less than 100 is normal, so it's all good. Life is good. All right, we're almost there, and now we're going to go over last 2 higher functions, the first one being evaluation. So evaluating is all about knowing the outcomes. So here, the patient is taking levothyroxine, and he tells the nurse that he's very anxious, and then he has occasional palpitations. And which action by the nurse would be appropriate? So if my patient feels very anxious and he has palpitations, he is very uncomfortable, what do we do? Are we going to check the lab results and find out if anything is abnormal? Are we going to take the blood pressure? Are we going to palpate the patient's thyroid? Sorry for the typo. Or are we going to administer the anti-anxiety medication to this patient? Now, if I have to choose the first option, why am I choosing it? Are these assessment findings telling me that the thyroid levels, T3, T4s, they might be too high if that's the case? If I have to take the blood pressure, again, if there is a direct link, and what would happen when I palpate the thyroid? Because this patient has hypothyroidism. So is it abnormal if it is enlarged or not enlarged or whatever? And then what will happen as a result of anti-anxiety medications? So think from that point of view and mark your answers. And let's see. Now, if you look at the questions, don't you think we need more information? because the patient's symptoms are anxiety and occasional palpitations. So if you think that you need more information, which answer would you pick? Yeah, that's right. So we're going to pick A, where we're going to check lab results, because this is where we will know the levels of thyroid hormones, because these symptoms, they look like that thyroid hormones, they have increased. Now, anti-anxiety medications, that's going to just do nothing but mask our patient's thyroid dysfunction. So we might not want to give it without knowing the underlying cause. So as you can see, this one is a very higher level of understanding, right? You need to know more than just knowing the signs and symptoms for solving this particular question. So that is why we have to really study things in detail. Just superficially studying them might not answer all our questions. And then the last one is creating. Here, we're going to talk about like teachings and constructions and stuff. So we have a group of patients with thyroid dysfunction, and this group is taught about their disease. We have one patient who is taking levothyroxine, and he states that he does not understand the reason. The patient tells the group that he takes the medication inconsistently because he does not even know why is he taking the medication in the first place, right? So if you are teaching one of this kind of a group and one of the patient is talking like this, which will be the best thing which the nurse should do, right? Okay, so the nurse should, A, tell the patient to go to his doctor. Do we like to pick these kind of answers where we want them to go to their doctors? Hey, I'm not even going to answer your questions. Then talk to the patient after the class, like totally ignore that, hey, I'm going to tell you after the class. What if there are more people who have similar queries and questions? Are we not going to acknowledge that? So think about it. Then readjust the teaching to emphasize correct medication administration. Might be because, as I said before, there might be other people who might have similar questions. Or tell the class that this is incorrect and suggest that the patient has individual class sessions. Now, what will happen if your teacher tells you to do this? Hey, you're wrong, and I think you need individual therapy. You are actually put on the spot. So the patient might not like that, right? So based on the explanations which I gave you on each point, which do you think would be the best answer? And this is all about therapeutic. You don't need to know what levothyroxine does here in creating. You need to have a very solid knowledge of therapeutic communications, because you can't study everything. So there will be one such question where you have no knowledge, you don't know what that disease is, you don't know what that drug is, but the question is about like this, like which is the best dialogue by the nurse, or which is best action by the nurse. So now think from that point of view and give your answer. And I hope you all chose C, because readjusting means that I am modifying my teaching and I'm emphasizing, because one of you said this, and there could be other people too who might need information on why are we taking levothyroxine and why is it very important for this medication to be taken once a day consistently without missing a dose. And then this class might take a different direction, but that's what was the need of this teaching, right? So, all right, so these are all the things which will help you in prepping for your exam. Just the way I took example of levothyroxine, you guys can definitely make your notes based on Bloom's taxonomy and study based on this, if that's possible. And this is the way we like to teach. And yeah, and let us know if you have any more questions. This was my reference. I took this all information from NCLEX RN Excel. Yeah, thank you very much for making this book. And thank you all for joining me for this session. And you can always subscribe to the channel, and you can always email or message us whenever you have any questions related to NCLEX or REXPN. Thank you guys. Thank you so much.